I'm very excited to introduce today's guest. She's someone I personally see as a role model for female entrepreneurs in healthcare. Charlotta Tönsgård is a Swedish healthcare and health tech entrepreneur, best known for her role as the former CEO of Min Doktor, one of Sweden's early large digital healthcare providers. She has spent many years working at the intersection of healthcare delivery and innovation and leadership, navigating both the promise and the complexity of building companies in this space. Beyond Min Doktor, Charlotta has gone on to fund and lead several health-focused ventures, including Kind app, and later joined as CEO for Migränhjälpen, continuing to tackle some of healthcare's most challenging problems. In today's conversation, we'll talk about what she's learned from building and leading healthcare companies, the realities behind scaling digital health, resilience when things don't go as planned, and how she sees the future of healthcare innovation in Europe. Charlotta, I'm really glad to have you here. Welcome to Walk the Valley.
Thank you. Super excited to be here.
Please tell us a bit about yourself. How long have you been working in healthcare innovation and leadership?
So I still say that my background isn't in healthcare. So the first decade I actually spent in the mobile industry. I've done everything from hardware to software there. My background is in engineering and business, but I mean, it's almost not being okay to say that anymore because I've been in healthcare now for, over a decade. My entry point to healthcare and digital healthcare was through Min Doktor, as you mentioned in the beginning.
How did you end up in healthcare?
Yeah, it's a good question, and I wish I had like a cool reason, but it was really a coincidence. So I think, I've always been excited by technology. I believe it's the superpower that makes it possible to do stuff we couldn't do without it. But I just reached a point, I think, in my career where I love working with smart people. I love bringing new innovation to the hands of people. But the stuff I was doing, it just wasn't important enough, I guess. I saw there is real challenges out there, and I just felt I needed to work with something that had some kind of impact some way. So I had resigned my job, but I hadn't made anything public about it. And then an investor that I still really admire, I think strongly of, he contacted me out of the blue and asked me to look at a case. And that was Min Doktor. To me, it felt like closing a circle. This was definitely not about cutting edge technology. This was about adopting things we already know to be true because it's been tested elsewhere. But the kind of impact that could happen if we apply that correctly, that was, to me, it was really closing a circle.
Mm-hmm. So Min Doktor was the first healthcare related company you joined.
I would say that it was my first introduction to healthcare at all. Knock on wood, I hadn't been that sick before. I had very little contact with healthcare. I had my first pregnancy in Seoul, in South Korea, where I was working, and came home. And by that experience, I would say I had the feeling that there were room for improvement in Europe. But I had very little experience looking at that segment before.
You must have learned so much at that time about healthcare. What was the most shocking thing that you discovered when you joined this field?
There were many shocking things. And now, looking back super naively, as I said, I came from a tech background. Up until that point, I had only worked in technology companies. And I kind of naively thought that there were actually a lot of similarities, because if you take a traditional, or a normal tech company, you basically have, and if you're a leader of that, you know that the only thing valuable you have, it's the people, right? If you take away the people from a tech company, there's basically nothing there. And you have highly skilled people, but of different competences. You might have engineers and testers and designers and project managers. And all of them, they also acknowledge that they need each other to be able to produce something. And as a leader, you know that the most important thing you have is these individuals. So you need to ensure that they are as happy and productive as possible. Otherwise, you don't have anything. And in many ways, from my perspective, I was healthcare should be the same, right? If you take away the people from healthcare, you would have buildings and machines, but nothing would happen. And you have highly skilled workers, you have your nurses and your doctors and your assistants, and everyone is needed, otherwise nothing happens. So I kind of assumed that it would be a bit of the same, just looking at it from a company perspective. I had this gig when I was studying where I was the head of a factory that made cement. So I was the planning director for that factory for a sick leave I was filling in. And there was so much more similarities between managing that factory and how you thought about people and stuff and healthcare then it was a tech company. And I would say that that was a huge, just mind-blowing for me in the beginning. I think the second part would be that in most other businesses, I would say that you are aligned on what you're trying to achieve. Like, what is the purpose? And then you kind of build your processes and your organizations to make that thing happen. And I think in healthcare, we're lagging a bit. What are we actually organizing healthcare for? Like, what is it that we're trying to achieve? How do we build incentives and business models that really make us do that thing? I think we're kind of stuck in the 50s or something in some of these areas. So that was also surprising to me.
Yeah, I think it still comes down to being reactive in healthcare instead of having a goal of making everybody healthy.
Yeah, exactly. And I think it's, still, if you go back to that field surgeon going back a couple of hundreds of years ago, that feels like almost we were still organizing healthcare based on those old thinking about healthcare. Not so much about, as you say, like, how do we keep as many as possible, as healthy as possible, as cheaply as possible. It doesn't feel that we're super aligned on that.
This brings me to my biggest shock that I've actually just recently discovered in healthcare. Although I've been working with medtech for about 6-7 years now, I see that all these companies, we still have a lot of companies in healthcare, and we know that 80% of healthcare startups fail, but a lot of very well prepared, very well supported, very professional companies, good teams, great product, could revolutionize healthcare or even just fix the gaps in healthcare, but they can't get in. And why can't they get in? Because on the healthcare side, there's no ownership of the process. So there's processes to procure products that are in development to help them develop, and there are processes in place to procure innovative products that help certain departments to work better. But the pipelines are very thin and the processes are very
complex,
difficult, long, full of bureaucracy. So it's really difficult to get into the healthcare. So there's this disparity where we come with our medtech products and we're super prepared. Whole ecosystems are built around us to support us to deliver to the healthcare system. But then the healthcare system doesn't have that kind of support.
No, and it's and I think also incentives. I think, you shouldn't underestimate incentives. I think it's this is might be like a politically sensitive thing to say, but there is a reason why in most regions in Sweden, you have a mix of publicly operated and privately operated healthcare providers, even though it's publicly funded. Mm-hmm. And most have seen that kind of a little bit competition, it's good for the system. It means that we get more healthcare out of that money spent. One of the reasons it works in private is because you have incentives and people, they fear that you have that, but I think it is also needed to drive innovation. And then if you take that back into like a public procurement, like what are the incentives for the people who work in there to actually bring the best healthcare out there for their citizens? What are their incentives? I think they're often not even existing. Like they have a high probability of being hanged and being kind of shamed if something goes wrong, but there is no incentive or no culture in actually making progress. And I think that is really dangerous to have. And it makes it stagnant. It doesn't make us feed innovation.
And in your experience, what can we do as entrepreneurs to overcome this obstacle?
I think you need to decide early if you are you completely dependent on public money? Like if you're building this product, no matter if it's like a physical product or if it's just software, like, are you completely tied up business model wise to publicly funded? And then you need to, if that is true, then you need to build a company based on that. You need to figure out, where do I hook in? This is going to take time. You need to kind of really align on that. And if not, I would really encourage you to kind of build your product in tandem with public, because I want my companies to feed into the public good. That's important to me. But I'm not going to be completely dependent on it because I don't think it's moving quickly enough. And if you become completely dependent on it, you lose the ability to shape the future of your company. So you need to decide early, like, am I completely dependent on it? Then you need to go that path, and you need to figure out, or you need to know that it's going to take time. You need your investors to be aligned with that. You need to build a team based on that and everything. And else, I would really encourage you to build in tandem.
Mm-hmm. This is really good advice, I think. And also, Very interesting. Is there a capacity in a startup team to build in tandem, to run two different business models alongside?
I think Kind is like my previous company is an example of something that was built in tandem. So Kind was a communication platform for healthcare teams to communicate more efficiently with their patients. In Sweden, almost all of our customers, they were publicly funded. So the healthcare they provided, it was publicly funded. But we only sold to private enterprises, which meant that we could act a little bit more like a traditional enterprise SaaS in terms of how you get a buying decision and so on. And that I would say is a good example of kind of building in tandem. So it was definitely a tool that was used for public good, also like completely private healthcare, but most of it was for public good. But we didn't get stuck in the complexity of running publicly operated healthcare. But I think you need to be very mindful of this. And I mean, I have met so many entrepreneurs that for like 5-10 years, every time I meet them, they complain about how slow Region Skåne is, and they're waiting for some decision from someone to happen. And their company is completely stuck based on that. And that I think is on you as an entrepreneur to figure out like what type of company am I building and how do I set that roadmap where I'm not completely dependent on stuff that we know are slow.
I really like how you laid this out. This is so important to realize. When you became the CEO of Min Doktor and everything was just developing around you, the company was developing, this digitalization of healthcare space was also developing. What was it like to step into this role, and how did you manage to navigate?
I don't know if I did manage to navigate, to be honest. Like it felt like stepping into like just a tornado of things that I honestly didn't know before and didn't have experience from before. So I'm not sure if I would ever say that I navigated that properly. I did learn a lot though. And I would not take back that experience for anything. And it has shaped. I mean, I wouldn't know the things I know now that is shaping what I do now. I wouldn't know that if I didn't have that experience. But it was a whirlwind, and company building is a lot of different stuff, especially as a founder or CEO. You have the actual problem that you're trying to solve. You have the problem of building a business around it, building an organization around it, navigating investors and boards and stuff like that. So there's so many aspects of building a company. And if you're doing the VC route, you have that times 10 or 100 because everything happening so quickly. So you need to prepare yourself. And I think also like to be honest with yourself if that is what you want and if you're prepared to do that work, because it's not for everyone.
You mentioned the VC route, and I hear from here and there sometimes that healthcare startups shouldn't really work with VCs because it's really difficult to scale at the pace that a VC would expect and so on. What is your experience around it?
I've seen I've seen a lot about VC. I've been running and building VC funded companies for the last 15 years. So I think I've seen both the beautiful and the ugly and all in between. I would say that VC money has a really important role in healthcare and in healthcare startups. And if anything, we need more VC money going in. But as with a lot of other stuff, as a founder or CEO, you need to understand that fundraising journey, or like how you fund the company, it is very much tied to what type of company you want to build. So, and this is true for healthcare and it's true for whatever business you're building. Funding comes with different pros and cons. And that needs to be aligned with the type of company you're building. A challenge is, of course, if you get an investor, it doesn't matter if it's a VC or angel or a bank or whatever, that don't understand what you're building and they don't understand the nature of what you're building. And they put demands on you or expectations on you that isn't matching the type of company you can or want to build. Then it's an issue, but it doesn't really matter if that is healthcare or something else. I think one challenge in that first wave of innovation, if we call it that, like the Min Doktor and Kry and all of that, is that we were individuals like myself that came from the outside that didn't fully understand healthcare yet. We had investors that came from the outside that didn't truly understand healthcare yet. And everything was just we tried to build stuff really quickly. And I'm sad to see that a lot of investors, they got burned instead of learning from it. And also, I mean, there are definitely some entrepreneurs that also got burned from it and don't go back. I think that was more about, okay, we learned, now we need to adopt and apply.
And do you think coming to this space from outside, did it help that you didn't fully understand and you just had this drive to learn instead of just giving up, oh, it's not going to work?
Yeah, 100%. I think, and I definitely think we have too few engineers in healthcare. We need, and it's actually part of the problem why we don't see more innovation, that we don't have more engineers. I think one of the things that is interesting with engineers compared to other roles or other professions is that as an engineer, you're blank in terms of you're a tool, right? You don't have a purpose of your own, at least as I see it. Like you come in with skills and a toolkit, and then someone else tells you about a problem and you try to figure out how to solve it. I think that mindset going into healthcare, I would say that it was 100% a help, and we need more of that. I mean, of course, paired in with humility to the fact that you don't know the problem fully. You have to listen to others and you need to figure out how to connect the dots and so on. But that is true in so many fields. Engineers build airplanes, but they're not pilots, most of them. So I mean, it's, I think that mindset was important for me. And I think that we need more of that in healthcare.
And then you had to leave Min Doktor, and a lot of articles were published about it. Everybody was talking about it. We talked about failed ventures on the podcast, but we haven't talked about someone who had to leave the company that they led successfully. How did you experience that transition, and how do you feel about it now, looking back?
One, like it does feel like a lifetime ago, and in some way it is, like it's a long time ago. Going through at the time, it was horrible. I had never experienced anything like it before and or after. I think the combination, as you say, I was really proud of the work I had done. It was definitely not done, like we were just kind of scraping the surface of something, but I was actually happy with what we had achieved. And then this happened, and it kind of became this weird mix where that was the only thing that kind of was Min Doktor and me, was this thing that they fired me, and this person kind of publicly shamed me. And it's not something I would wish to happen again or to happen to someone else. But again, like I learned from it, and it's part of my experience now.
What do you do differently now when you go into ventures?
I think one of the things that became clear to me in connection to that is that I'm quite a pragmatic person. I'm very task focused. I have very easy to take ownership of stuff, even if I don't own. And this is not something like, I think it's more personality. I think I've always been like that. So I kind of, if I see something that needs to get done, I just get it done. And I don't care if I get credit for it or if it was my task to do whatever, like it needed to get done. And if I think I can do it, I will try. And I think it is a strength in me, but I could also see in this situation, it didn't really serve me. So I think to me now it's two things. One is to surround myself with people where I'm aligned, not only on the purpose, like what we're doing, but also how we're going to do it. The other part is that ownership matters. Like, even though it didn't matter to me, I mean, I was just an external CEO at Min Doktor. I didn't have a voice in terms of being an owner. I didn't think it matters, but it does matter. Mm-hmm. So not being too pragmatic always. Sometimes those things, they are important.
I can relate to what you just said 100%. And this is also a maturing process for me, at least, but I bet for you too.
So I think a combination of, you can't always pick everyone you work with. So you need to figure out, and you need to adopt, of course you need, but to a certain level. And then you also need to choose.
Yeah. And what are the sort of stuff you're working about right now?
It became very clear just the last few years that where I have become obsessed, it is around productivity in healthcare. I've tackled stuff from different perspectives, and I didn't really know what I was chasing. There was something like something, but I couldn't really put my finger on it. But just the last few years, it became really clear to me that it is that. Like, I believe that we need to get more healthcare out of every euro we spend if we're going to kind of build systems into the future that we actually want to have. And figuring out or kind of contributing to that in some way, that is what I'm here to do. And there is many aspects of that, figuring out productivity.
Mm-hmm. Everyone is talking about healthcare AI, like OpenAI, as ChatGPT Health just became operational in the US, and Anthropic's Claude for Health is out there, and maybe we'll get access to it in 2027 as well in the EU. What do you see in this space, and what are the biggest bottlenecks of adoption?
If we dissect that a bit and we look at maybe Europe like a bit first, I would say that my biggest fear is that in Europe in general, we have a much higher fear of being wrong than being encouraged to test. Mm-hmm. So I mean, in Sweden, for example, we have these You can have massive, slow projects. They can fail spectacularly, and that can happen. And it happens over and over again. But then like smaller, agile experimentations is not really encouraged. I mean, you can find individual champions that are willing to test, and you can do pilots and whatever, but it doesn't really get scaled out. It doesn't get scaled up. I think we need to figure out how to bridge this gap because it's real. I mean, healthcare needs to be careful. This is serious stuff we're dealing with, but we need to make sure that we don't blur careful into stagnant. It's very easy to just kind of give that stamp on something like, oh, but we can't test this. This is healthcare. It's important. Certain things we can't gamble with, but there's a lot of stuff that is around healthcare that is actually good to gamble a bit with and test more with. And I think we should also not believe that just because an individual does something, it means that it's better and it's going to be correct. I mean, I often see if we talk about AI, people compare, well, hey, here it made a mistake. Yeah, doctors make mistakes. I think as patients, as users of these systems, we kind of know that we don't always get to see the very best of X. We get to see a person, and that person is good at some things and maybe not, and mistakes happen. So I think Europe needs to step up. I think there are a lot of stuff in the US that we shouldn't copy when it comes to healthcare. But if you look at speed and adoption, we need to learn. Because my biggest fear is that if we don't innovate, we'll preserve the healthcare system from a decade ago. And the solutions will still come. So people will, and we can see that already, they start paying out of pocket for better options, the one that can afford it. So if we want to protect universal healthcare, we need to treat productivity as a key. We will have fewer workers, aging population, and AI accelerating all of this. So this is urgent. So if we don't start adopting public trust and the funding, it will be eroded.
That's super interesting. And it reverts us a bit back to what I said about the gap between supporting the entrepreneurs developing for the healthcare system, but how does the healthcare system get supported and get into this pace and testing and opening up to stuff that could happen?
Yeah, I think it's a good example. And it's, I mean, here I am a bit disillusioned. I mean, the healthcare system is complex. I think in the end, you as creator of a business, you need to figure out how to sell to your customers. And we can't expect the system to make that easy for us always. But what we can and should expect is that legislation and regulation becomes more transparent. So right now, I think, I mean, even in Sweden, there's been this, I don't know, like a decade or at least 5-7 years debate on like, can you use cloud services for healthcare? And it's like, okay, you need to decide on something. And that needs to be transparent and it needs to be easy to understand. Then, I mean, of course, it's the one who build the business that need to adhere to whatever legislation we put up. But one of the issues here is that it's really complex to even understand what you can do. And then the healthcare professionals, they become paralyzed by it because they don't know which decisions they can make.
You mentioned that it would be nice to have more small tests instead of spectacularly failing large projects, right? Where are the opportunities for testing in healthcare?
I think there have been a lot of opportunities to test. Most regions, larger healthcare provider like chains, they would have some kind of experimental group or something that has responsibility for running pilots or whatever. So I'm not sure if the problem is testing as much as it is rolling out. And also that, and this is complex, and I'm super humble to the fact that it is. Public money, especially if you take a region, for example, it's so much money that is actually being handled by these systems that we need processes in order to distribute them. Otherwise, you will end up with corruption and other stuff that we don't really want in the system. So there's some complexities needed, but we need to figure out how to break down these big decisions to something smaller, because that is how you limit risk too. This project that has been ongoing in Skåne, where we live, regarding this big shift in patient platform, it's been a decade-long project, and now we end up with nothing. And that system we need to figure out how to change that. I'm not saying that I'm a person that knows. I stay away from public procurement whenever possible.
Okay, well, that's an interesting thing to consider, to stay away from public procurement.
I mean, I applaud everyone who wants to innovate those systems. I'm just not patient enough to stay in that. So, I mean, if we talk in 10 years' time, some of the things that I'm thinking about when it comes to digitalization and productivity, I'm sure that will be the norm. But I'm interested in where I can change today, not in 10 years' time. And then I think that you need to probably stay away from some of the public procurement systems.
I see. It makes total sense. How many companies have you led and built so far?
I think this is the 5th time I'm CEO of a startup. So been a few.
Any patterns that you see across them?
I mean, I'm technology driven, so I would say that that is definitely like a pattern. As I said, like I believe that technology is the secret sauce to make stuff happen that couldn't happen without it. So if you look at the last decade, I would say that all the companies that I've been involved with has some kind of public good aspect of it. To me, it's essential now in order to become really excited. And I need to be excited to be engaged. I think it needs to have some aspect that is not just making money or making something fun. Like it needs to be something that also has an aspect of public good.
Mm-hmm. And of all the things that help you or your companies to advance, like support structures, mentors, investor relationships and stuff, what helped you the most? What was the most useful thing?
All of them that you mentioned. I think you need all those components, but in the end, it's often about individuals. Like there are individuals that are made a difference in different points in time. I think it's hard to pinpoint one thing. People, that is what makes the difference.
So the team.
Both the team, but also people around you, like mentors, investors, old colleagues, people that are willing to kind of go beyond a bit. I think that is what makes the difference. But also people who step up. I mean, you mentioned this with Min Doktor, and in the end, one of the things that made a difference there was actually that people spoke up. I was in this dark hole where like, okay, this happened and I felt vulnerable in that situation. I couldn't really speak up for myself. And I think it would have played out very differently for me, just how I felt about it, if no one had said anything. But the fact that people said something, that made a difference.
Very interesting. Thank you so much for sharing. When Finn Kettler was on the podcast, and he also is quite experienced on being on the market side of healthcare, because he used to work at Coloplast and now he's working with Neocare Nordic. He mentioned that it would be super helpful if all these support institutions like Vinnova or the incubators, they would collaborate better. The point that he made was that it would be good to support companies to get to the market, go-to-market strategy, but also to help them get out on the market. What would you change or add to the support system in the healthcare innovation?
I would say that the support system, their only focus should be to remove obstacles for the companies, to streamline regulation, to make whatever kind of fussiness from the system, to make that clear. I think that is the thing we need from the public. Everything else, I would say it is the company's responsibility to kind of figure out your business model, to figure out your product. Like that is stuff that you as a company need to do. And then of course, depending on what you as a team come with, you might need support or whatever. But I think from what do we need from the system perspective, remove bureaucracy. Mm-hmm. That is it. I mean, I would say like from the whole EU, from Sweden, from the region, from whatever small publicly funded innovator hub, whatever, remove bureaucracy. That's it. And then leave it to us as entrepreneurs to build stuff.
Mm-hmm. And then the safety aspect comes into the play, right?
Yeah, it is. But then that's the same for like normal healthcare. And I think that we need to figure out how to have those things live in tandem. Mm-hmm. And some things need to be involved. And those are like hard questions that we need smart people to spend time on. Right now, in most of countries, you have responsibility for healthcare performed. It's on an individual basis. An individual doctor is the one in the end that is responsible for the care they as an individual provide, which is the same as for a car. Like if you drive a car and something happens, you as a driver are responsible for that car. And the same way now, if we're going to have self-driving cars, we need to figure out how is that going to work in the system? Whose responsibility is it if it crashes or whatever? That is the same that needs to happen when healthcare transforms into more of systems and products and AI and stuff. And it's not something that's just going to shift overnight. But we need smart people. We need people to work on that and to create a playing field that makes sense, not for how healthcare was performed or is today, but how we actually want healthcare to be performed in the future. That is definitely like an EU question, and I would assume or expect the people that we elect into office to drive those and to create a good playing field for European companies to be able to be in the forefront of this in a safe way with the individual at the center. Because why would we want a system that doesn't serve us as individuals? It's our system.
Mm-hmm. I could carry on talking to you for another hour easily, but we're running out of time, so I have to ask our last question. If you had to summarize your startup lessons as a fortune cookie, what would it say?
Just do it. Don't overanalyze. Don't look for reasons not to. Just do it and be humble and learn.
Perfect. Last words to wrap up today's episode. Thank you so much.
Thank you.
That's it for today's Walk the Valley. Talking with Charlotta was a reminder that healthcare innovation is never just about technology. It's about incentives, systems, ownerships, and the courage to keep building even when the system moves painfully slowly. A few things really stayed with me from this conversation. First, if you want to build in healthcare, you need to decide early whether you're going to depend on the public system or build alongside it. Second, productivity is what will determine whether universal care can survive and improve. And finally, regulation and bureaucracy should protect people, but they should not paralyze progress. Charlotta also brought something deeply human to this episode, the reality that setbacks, public scrutiny, and difficult transitions can shape you into a stronger and wiser founder. If you enjoyed this conversation, please subscribe and leave us a review. It really helps us keep sharing honest insights from the people building the future of healthcare. You can listen to Walk the Valley on YouTube, Apple Podcasts, and Spotify. Thanks for joining us today, and until next time, keep walking the valley.